The heart of Melbourne, eerily empty and quiet as a 6-week citywide overnight curfew begins. It's near 5 million residents woke to a new normal and further restrictions. The Victorian state government has ordered more parts of the economy to shut down, including in retail, manufacturing and construction.
Whilst I never thought that I would be telling people not to go to work, that is what we have to do in order to stop the spread of this wildly infectious virus.
On Sunday, the movement of people was further tightened, with residents not allowed to move further than 5 kilometres away from their homes.
So this is our little setup in our tiny...
With schools again closed and millions stuck indoors, many people, including Kate Moulton, are again juggling work, isolation and homeschooling.
We're all trying to work, we're all trying to get schoolwork done. But definitely this time around we feel like it's really locked down.
Regional Victoria is also facing partial lockdown, though not as strict as Melbourne. Some say the new measures will trigger thousands of job losses and stand downs statewide.
It is hard for businesses now having to go through 6 weeks and then work out how they ramp up past that, how some businesses will be able to survive.
Financial grants will be available for businesses forced to close, as well as workers who have exhausted sick leave.
What we're dealing with here is a disaster, and we need to respond on the basis of the way we provide support in the midst of disaster.
While border closures have largely kept the virus within the state of Victoria, there are clusters emerging within New South Wales, in particular Sydney, and the federal government has warned the economic fallout will be nationwide. Victoria makes up about a quarter of the national economy, and with COVID-19 cases remaining in the triple digits daily, many are wondering if it's realistic that numbers can be driven down in 6 weeks. Nicola, Gage, Jazeera, Sydney.
Let's bring in Dr. Bharat Pankhania. He's a senior clinical lecturer at University of Exeter Medical School in the UK. Good to have you with us. So first of all, why does it seem like some countries have managed to escape a second wave and others haven't?
Well, it all depends on how many cases they had to begin with. So if you start from a high level, it is almost impossible to regain control. And if you act fast, act early, act hard, like New Zealand did, you can then reduce your number of cases and regain control. So this is the game of chess that we have to play, and we have to play it with the science, which is act fast, act early, act hard, and you regain control. Act slowly, act reluctantly, and you find it very difficult to maintain and regain control.
So then hang on, Doctor, does that mean those countries which did not act fast, their lockdowns have failed? Even if they put in a very stringent lockdown later on, the fact that they're seeing a second wave and talking about another lockdown, does that mean the first lockdown is useless if you haven't come in early enough?
The second lockdown will have to be very prolonged, and that makes it difficult because we cannot have a very prolonged lockdown. And this is why I'm very concerned that if you have a lockdown and then you have a premature lifting of the lockdown, you undo the pain, the cost and the expenses of the initial lockdown very, very quickly. Therefore, speed is always of the essence, and early speed allows you to regain control, whereas later on, it's much harder.
When you look at the second lockdowns going on right now, are they any smarter, shall we say, any more developed, any more targeted than the first round of lockdowns, or have we learnt nothing?
Well, what we have learned is that this infection is still generating cases. We've got to be careful. The virus has not gone away. And really, the public health message is don't drop your guard. You can get infected. Don't get infected. Don't infect others. This is very important. And if every single person took infection control precautions, we would have less drastic restrictions or lockdowns, as we refer to it.
What about those countries that didn't go ever for a very stringent lockdown and went more for things like tracing and testing? South Korea, comes to mind. I think even Sweden hasn't done too badly relatively, and they didn't have a very stringent lockdown.
Well, South Korea acted very fast, very efficiently with regards to its testing and tracing. And as a result of a superb effort, they released an army of people, a large number of people to test and trace. They were able to remove people from circulation.
So is that more of a solution rather than another lockdown? Should countries be looking at that?
Without a doubt, because I think lockdowns are a coarse measure, whereas a more precise measure is to test and contact trace extensively.
All right, it's wonderful to get your thoughts on that, Dr. Bharat Pankhania there.